So, Bismillah Rahman Rahim. So, today our topic is nuclear pharmacy. We will learn today about nuclear pharmacy. You are aware about nuclear. What is a nucleus? So, it's related from the particles which are mostly radioactive. It is also known as radiopharmacy also. Nuclear pharmacy, the another name is radiopharmacy. You see that a pharmacist is preparing doses for preparing radiopharmaceuticals. Pharmacist is preparing radiopharmaceuticals in a hot lab. So it's a radio. What they are preparing? They are preparing radiopharmaceuticals. So the definition of radiopharmacy is that it is a subspecialty of pharmacy, deals with receiving, preparations, quality control, storage, and dispensing of radiopharmaceuticals. Radiopharmacy also deals with disposal of radioactive waste, documentations, research, designing, development of new radiopharmaceuticals. So, as you are aware of various medical specialties, in medicine, there are different specialties. Similarly, there are subspecialties of pharmacy. You are aware, hospital pharmacies, there, clinical pharmacies, there, industrial pharmacies, there, so many names, veterinary pharmacies, there. Similarly, this is radio pharmacy. It is also a branch of that pharmacy. So, what it deals? What the function of radio pharmacy is that? What the disposal of radioactive waste. Now, after the completion of that process, whether for diagnostic or whether for therapeutic use of radiopharmaceuticals, the radioactive waste has to be properly disposed of. Then they have to prepare various documentations of the usage of these radiopharmaceuticals. Also research for the new diagnostics or treatment of the radiopharmaceuticals. They also designing how to apply these radiopharmaceuticals, development of new radiopharmaceuticals. So then it all covered under the heading of radiopharmacy. Further, we can say that radiopharmaceuticals derived from two words. First is radioactive and pharmaceutical. There are two words, radioactive and pharmaceutical. Pharmaceutical, aware that they deals with the drugs, and radioactive means which gives radiations. It is a medical product containing radio tracer, present in minute quantity, not intended for pharmacological action. What is a radio tracer? So radio tracer or radioactive label is a chemical compound in which one or more atoms have been replaced by radionuclides. So by virtue of its radioactive decay, it can be used to explore the mechanism of chemical reaction by tracing the path that the radioisotopes follows from reactants to products. So they are radio tracer. Now, what is the radionuclides? Is an atom that has excess nuclear energy, making it unstable. That is a nuclides. The radionuclides, an unstable species containing specific atomic number and responsible for emission of rays. So you can see on the right side a radiopharmaceutical. It is a different dosage forms. It's a different drug as compared to other ordinary pharmaceuticals. It has the label of that symbol of radioactive also shown, and its color in white, in yellow color label is there. So all the description written over there. So you can say it is a radiopharmaceutical combination of radioactive and radioactive material and pharmaceutical. Is it clear? In radiopharmacy, the service and unit from where the radiopharmaceuticals are provided is called radiopharmacy and hot laboratory. The person who rendered this service is called radiopharmacist. So the service and unit from where the radiopharmaceuticals are provided is known as radiopharmacy. In a hospital where the drugs are applied are known as hospital pharmacy. So industrial pharmacy means where the drugs are formulated, drugs are manufactured, that is a industrial pharmacy. Clinical pharmacy means where the drugs has to be applied to the patient. It is in a hospital, in a clinic known as clinical pharmacy. Now, understand the definition of radiopharmacy? The service and unit from where the radiopharmaceuticals are provided is called radiopharmacy and hot laboratory, because all the preparation has to be done in the lab. It's a different in style as compared to other hospital pharmacy. Now, the person who rendered the service is called radiopharmacist. Now, organization. The radiopharmacy service is rendered from a division of hospital pharmacy or by a section under nuclear medicine department. So it is a rendered from a hospital pharmacy, or it is a section under nuclear medicine department. The management of nuclear medicine department is that it contains the physicians, radiopharmacists, medical physicists, nuclear medicines, technology. The physician can be an oncologist if it is applied for cancer patients. It can be a diagnostic. He have experience in radiations. Then they have a radiopharmacist over there, medical physicist who is trained in physics, because mostly these equipments are run by a medical. You must have a degree in physics, master's or whatever, MPhil in physics, and then he has an experience in radioactive materials. So he's known as medical physicist also. Then under that one, the nuclear medicine technologists who have handled these materials. Discriminatory properties of radiopharmaceutical are different. A radiopharmaceutical has the following discriminatory features: presence of radioactivity, must they have a radioactive presence; scarcity of pharmacological effect, having short half-life, usual route of administration, dose measurement in terms of radioactive units, half-life, practice, regulations, restriction and quantity use. So what is discriminatory difference? Over there, the instability of that. They have presence of, they must be a radioactive. They have a radioactivity. They must be radioactive. The radioactivity, scarcity of pharmacological effects. They have pharma action over there. They must have short life, because as compared to other drugs, they have longer half. Here, when you apply these things, they have to be excreted fastly. Usual route of administration, by which oral route or by injectable, whatever it is to be applied. Dose measurement in terms of radioactive units, because in terms of other pharmaceuticals, you can measure in grams, milligrams, whatever different. Here, the measurement in terms of radioactive units has to be done. You must know about various radioactive units. Half-life, also known of these radio materials. Practice regulation, how it can be applied. Restriction on quantity use. So it's a very delicate, very typical subject which have to be applied very carefully. Half-life of radiopharmaceuticals. There are three half-lives, physical half-life. Time necessary for the radioactive atoms to decay 1/2 of their original number. Now, mostly you can see radioactive material, they have a different half-lives, the original half-life. Then there is a biological half-life, time required for the body to eliminate 1/2 of the administered dose, that is biological half-life. Then effective half-life, time required for an administered radiopharmaceutical dose to be reduced by 1/2 due to both physical decay and biological elimination. Applications of radiopharmaceuticals. The radiopharmaceuticals are applied for what? Diagnosis, treatment, and palliative care. It has three uses. It has three applications, three uses. First, they can be applied for diagnostic purpose, for the how to find out a disease, a stage of disease. Then they can be applied for different treatment of different cancers, or where they are applied. Palliative, just to control the disease over there. The diagnostic application. So mostly what they do, gamma emitting radiopharmaceuticals are used to probe physiologic and pathophysiological functions of human body. They apply gamma emitting radiopharmaceuticals. Then large number of radiopharmaceuticals are available to trace one or more particular functions of human body. For optimal detection efficiency by gamma camera, gamma energies of between 1000 kilo electron volt. It is a keV, kilo electron volt, and 200 kilo electron volt are desirable. Example, technetium 99M, iodine 123, iridium 111, thallium 201, gallium 67. So these are various radioactive materials which are used for diagnostic purposes. Therapeutic applications. Radiation emitted from them causes selectively damage to neoplastic cells of the body, means cancer cells. They normally contain a radionuclide. They normally contain radionuclides that decay by emitting a beta particle. The beta particle should be ideally within the range 0.5 to 1 mega electrovolt. Half-life is normally of several days to provide reasonable time of action. Example is iodine 131 and phosphorus 32. So these are applied for therapeutic uses. Palliative applications used to improve quality of life but cannot eradicate a disease. Example is strontium 89 and phosphorus 32 are used to relieve the pains due to cancer metastasis in bone at terminal cancer stages. I think we have to finish over here. So next time we'll go for